This is a denture. This is an all-on-4. And this is a 3-on-6. Hi, my name is Dr. Randy Roberts and I'm a dentist here at Smile Clinic in beautiful Salt Lake City, Utah. We hear a lot of patients with compromised teeth asking which is the right treatment for them. In this video, we'll discuss dentures, overdentures, all-on-4, and 3-on-6, the advantages and disadvantages of each one, and which solution should be used for which patients. I'll give you some tips that will help you know which treatment option is likely best for you. And by the end, you'll be an expert on the various full mouth smile restoration options. This is an implant. When patients think of an implant, they're often referring to the full combination of an implant with a connecting abutment and a crown or a bridge on top. Implants are probably the most significant thing to happen to dentistry in the last 100 years. Some are made from zirconia, but the majority are made of titanium, just like a hip or a knee replacement surgery. This means our bodies don't reject them and the bone actually fuses to the implant, giving us a solid anchor to restore the tooth. The abutment is then attached to the implant, followed by a crown or bridge on top. If you're looking to restore one or a few teeth, single implants are the way to go. However, if most of your teeth need to be replaced, individual implants on each tooth can get expensive. For that reason, various full arch restoration methods have been developed. Let's dive into the first one. Dentures have been around for over 2,000 years and were originally created using animal teeth. George Washington had a denture which incorporated both human and animal teeth, so they're old technology. The main advantage of dentures over other options is that they're relatively cheap. Dentures can also be used even with severe bone loss. They are easily removed, although this is a downside for most people. Aesthetically, they can also give a great looking result. A full mouth of dentures will generally be in the price range of $2,000 for a basic set, up to $10,000 for a premium set. This will vary depending on the quality, and any extractions or bone grafting would be extra. Many people report that they love their dentures and recommend them to others. Dentures, though, come with several common disadvantages. First, they're just bulky. They cover the roof of your mouth, which doesn't feel natural. Food can get trapped underneath and can be painful and cause sores. A lot of people have a gag reflex and find themselves drooling with dentures. You also can't eat whatever you want with a denture. Most people can't eat steak, salad, or corn on the cob, or chew gum or candy, or any of the things we love to put in our mouth. Also, dentures have to be removed at night and soaked in a cleaning solution. Overall, they're a pretty big pain to deal with. But the biggest reason why I, as a dentist, dislike dentures is because your bone will continue to deteriorate with a denture. Why does that matter? Well, the shape of your mouth will continue to change, meaning your denture won't fit properly anymore. We've all seen those embarrassing videos of people's dentures falling out, right? So to try and prevent this, people will add denture glue to try to keep it in their mouth. As enough bone loss occurs, even the glues won't keep a denture in your mouth, and you'll have to pay for new dentures. You'll also be excluding yourself from the opportunity to get implants if you've lost too much bone. So who should get dentures? I believe you should avoid dentures if at all possible. If you can't afford an implant-supported solution, or if your bone loss is so severe that you can't get implants, then a denture might be the right solution for you. If you're unsure if you have enough bone for implants or have been told you don't, I'd recommend getting a second opinion from us. Our doctors are experts at finding bone for implants and can also offer alternative options like zygomatic and pterygoid implants if there has been severe bone loss. If you're considering dentures because of a lower upfront cost, keep in mind that dentures are the most expensive option when you factor in long-term maintenance. The 10-year costs of dentures, adhesives, cleaning solutions, adjustments, and replacing the denture actually make them the most expensive option over 10 years. Overdenture. The next option is a level up from the traditional denture called an overdenture or snap-in denture. The overdenture is basically a denture that is snapped onto usually 2 or 4 implants. An overdenture is an improvement because it at least gives the patient a few implants to support their denture. This can help prevent those embarrassing moments and reduce the need for denture adhesives. Because the denture rests on implants instead of the gums, you may get fewer mouth sores. Overdentures don't have to cover as much of your palate like a traditional denture. Also, the implants will support good bone health and prevent some bone deterioration in the locations where they are placed. Overdentures are significantly more expensive than dentures, usually priced between $5,000 and $20,000 per arch, depending on the number of implants and the quality of the denture, not including extractions or bone grafting. While they are much more stable than dentures, I still wouldn't say you can eat anything that you want. You'll still have problems with some hard foods and may notice rocking of the denture as you eat. You can also accumulate food under the denture while eating. Similar to a denture, it needs to be removed every night for cleaning. While it's nice that they can be snapped on and off to clean underneath, the constant removal and replacement will eventually cause the connections to wear out. These sometimes need replacement once a year, which adds significantly to the maintenance cost. Also, this is still a pretty bulky restoration and will never feel quite as natural as other options. Okay, so who is the right candidate for an overdenture? In my opinion, if you're going to spend that much money on implants, it would make more sense to upgrade to a permanent, non-removable solution. I'd only recommend the overdenture if that is the top of your budget, or if for some reason you want removable teeth. Personally, I really dislike overdentures. I want my patients to be happy, and overdentures in general require more maintenance. So let's move on to the next option, the All-on-4. This can also sometimes be called All-on-6 or All-on-X. These are basically the same restoration, only with a different number of implants, 4, 6, or X, meaning any other number of implants that the dentist will recommend. In an All-on-X, the patient usually receives 4 to 6 implants which are used to secure a denture onto an arch or a full mouth. Some consider this a permanent restoration, but I consider it semi-permanent, and I'll tell you why in a minute. This has become a very common procedure for restoring a full mouth of teeth. This option generally will cost between $40,000 to $80,000 for a full mouth. Again, depending on the number of implants placed and the quality of the restoration. The All-on-4 or the All-on-X can be a great option for the right patient, and we do the All-on-X frequently at our practice. So let's talk about the advantages of the All-on-X. First, it doesn't require daily removal for cleaning, which saves time and discomfort. It also doesn't cover the palate, so speaking and eating will feel a bit more natural. With All-on-X, you can basically eat the same foods that you would eat with your natural teeth without any problems. It's very secure and isn't going to fall out unexpectedly. If you've had significant bone loss, your face might have a sunken in look. The All-on-X can correct this by adding artificial gums right above the teeth. If done right, the All-on-X can look beautiful and natural. While this is a fantastic option for many people, there are downsides to this treatment. Again, this is still a rather large foreign object in your mouth, so it will take some getting used to and will probably never feel like your natural teeth. We just had a patient in our office last week that received a beautiful All-on-X from another dentist, but just couldn't stand how it felt in his mouth. If you hang out to the end of this video, we will show you how we gave him a much more natural feeling option. Cleaning an All-on-4 can be another issue. Some can be cleaned underneath, but I'd say that most All-on-4s are so thick that properly cleaning underneath the denture can be nearly impossible. For this reason, All-on-4s need to be removed by a dentist about every year to clean underneath. That's why I call it semi-permanent. It's not healthy to allow that food to stay under there and accumulate bacteria. So it needs to be removed and cleaned professionally by a dentist and not just a hygienist. Cleanings are therefore much more expensive than a standard cleaning. Also, like the overdenture, the removing and reattaching of the All-on-4 will eventually require some parts to be replaced, and this can get expensive. The biggest problem I see with the All-on-4 is that many of the patients who receive it have bone removed at the time of surgery. This is called alveoplasty. Again, if you already had significant bone loss, the All-on-X can be great to fill in that missing space. In most cases though, you don't want to remove healthy bone and replace it with artificial bone. Sadly, many patients I see who had All-on-4 weren't informed by their doctor that they were removing their bone during the surgery. So what's going on is the doctor needs a flat surface to attach the denture to, and they also need to hide the transition of the fake gums under the patient's lips. So to create the space for the denture, they do that by removing the patient's healthy bone and gum tissue. If you don't remove enough gum and bone, then you'll see that transition line. At the end of this video, I'll show you a patient we helped who had an All-on-4 done and her doctor didn't remove enough bone, so you could see the full prosthetic. So who should get an All-on-4 or an All-on-X? This is the best option for patients that are missing a significant amount of bone and need the artificial gums to fill in where their bone has already deteriorated. I don't like to remove healthy bone. So if you've had extensive bone loss but still have enough bone to support dental implants, All-on-X can be a great solution. Three on 6. Finally, let's take a look at the 3-on-6. The 3-on-6 is the only option that doesn't have a denture or fake pink gums. It uses 6 implants to support 3 bridges across a full arch of the mouth. So it replaces missing teeth with teeth, no artificial gums. The 3-on-6 was developed here at our Smile Clinic offices and has been placed in thousands of patients over the last 10 years with incredible results. So obviously the biggest advantage of the 3-on-6 over the All-on-4 is that you don't have to remove bone to place it. We are just replacing the teeth with teeth. Not only does this make surgery and recovery less traumatic, but it also gives you options. If the All-on-4 fails or the implants fail, you might just have to go with a denture. With the 3-on-6, however, in the rare case that something happened, you still have all that healthy bone in your mouth for other implant options. I also love that the 3-on-6 can be cleaned easily at home with brushing and flossing. When you go in for your dental cleanings, it doesn't have to be removed by your dentist. Since there are no artificial gums, it feels normal in the mouth and takes less time getting used to. Most patients tell us that they often forget that they don't even have their real teeth in their mouth. One downside to the 3-on-6 is that it can only be placed if there's enough healthy bone in your mouth. Fortunately, we find that the majority of our patients have sufficient bone, including many who were told by their dentists that they don't have enough bone for implants. I've placed hundreds of 3-on-6s and All-on-4s. My professional opinion is that if you're a candidate, the 3-on-6 is by far the best and safest option on the market for a full mouth implant supported restoration. If you're not a candidate, we can let you know and present you with another solution like the All-on-X. Many of our patients that have gotten the 3-on-6 were told by other dentists that only provide the All-on-X that they wouldn't qualify for a 3-on-6. Most dentists haven't been trained in the 3-on-6, so we recommend that you get a consultation with us. Only licensed 3-on-6 providers can perform both the 3-on-6 and an All-on-X, so only a licensed 3-on-6 provider can tell you if you're a candidate or not. If you're considering either option, we recommend visiting with a licensed 3-on-6 provider who can let you know about both options and recommend what is best for you. Okay, so I promised I'd show you some patients and case studies. So here's a patient. We will call him John. John got an All-on-4 recently. It was actually a pretty nice All-on-4. The implants looked good, the prosthetic was made well. Unfortunately, he hated how it felt in his mouth. He came to us just 2 weeks after getting his All-on-4 and told us that he just couldn't stand it. He had heard about the 3-on-6 and wanted teeth that just felt like teeth in his mouth again. So we took out his All-on-4 denture and gave him a 3-on-6. Because they removed some bone at the time of his surgery, we had to make his teeth a bit longer than we normally do to make up for that last bone. He loves the feel of his new teeth. He told us that had he known how the All-on-4 would feel in his mouth, he would have just gone with the 3-on-6 out of the gate. So anyone who looked at John saw a beautiful smile, and that was awesome. And that's what you can get with the All-on-4, a beautiful new smile. But what was important to him was it feeling natural and functioning natural. And that's what we gave him with the 3-on-6. This next patient also had an All-on-4 done, and she actually didn't have enough bone removed at the time of her surgery to hide the bulky denture. So as you can see here, the All-on-4 prosthetic was sticking out from under her lips. She couldn't really eat with this and was mortified about how she looked. The dentist would need to cut away even more bone in order to be able to have a good-looking All-on-4, and instead of doing that, she decided to come here to get the 3-on-6 performed. We removed her All-on-4 and gave her the 3-on-6. As you can see, her transformation was incredible. Night and day difference. She cried when she saw her smile for the first time. When this patient came to us, we determined that the All-on-4 would be the best solution because of the extensive bone loss. We didn't have to remove large amounts of bone because it was already missing. This is a great example of an appropriate use of the All-on-4. As you can see, it helped fill in the missing bone and tissue and created a beautiful result. This patient, we'll call her Melissa, was told that the All-on-4 was the only option for her. The day before she put money down for her treatment, she heard about the 3-on-6 from a friend. She wanted to preserve her bone and tissue so bad that she canceled her treatment with her other dentist and flew in from New Jersey to see us here in Utah for a consultation. We determined that she had plenty of healthy bone and we recommended the 3-on-6 treatment for her. As you can see here, we didn't remove any bone or gums and were able to restore her teeth in a much more conservative and healthier way.
Woo!
So hopefully you're now a full mouth restoration expert and understand the various advantages and disadvantages to consider with each option. To be clear, there isn't a one-size-fits-all solution. For some people, their limited budget might make a denture the best option for them right now. Or maybe you've lost a lot of bone and you need the fake gums with the All-on-4. With that said, I firmly believe that the 3-on-6 is the best permanent smile restoration solution for a patient that has sufficient bone. As I mentioned before, over 85% of the patients that walk through our doors have sufficient bone for a 3-on-6, while the other 15% would benefit more from the All-on-X type solution. So if you'd like to learn more about the advantages of the 3-on-6 treatment, you can go to 3on6.com. You can also click here to watch a bunch of real patient stories of people who decided the 3-on-6 was right for them.